Dear listeners, welcome to Faces of Digital Health, a podcast about digital health and how healthcare systems adopt technologies. I'm your host, Tjasa Zajc, and today you're going to listen to how health insurance companies look at digital transformation. You will hear from Rajeev Ronanki, Chief Digital Officer at Anthem, which is striving to become a digital AI-first enterprise. In September, Anthem launched a digital incubator where companies can test their solutions on Anthem's anonymized data. Among other things, Rajeev spoke about what kind of mindset shift happened in insurance companies due to COVID, how does an AI-driven insurance policy mindset look like, and how will AI shape the future of healthcare? Enjoy the show, and to browse through other episodes as well, go to www.facesofdigitalhealth.com. In the previous episode, you could hear from Dr. Brennan Spiegel, the author of the recently published book VRX, explain what over 5,000 clinical studies so far taught us about the healing power of virtual reality. If you'd like to be notified about new episodes of the podcast, subscribe and they'll be automatically added to your podcast library. Coming up soon are a discussion about the current state of blockchain in healthcare and also an introduction to digital health in New Zealand. But now to Rajeev Ronanki and digital health in the health insurance space. Rajeev, health insurance companies are not exactly a popular entity in the US. People are underinsured, claims get denied, and more. So what's your opinion of healthcare insurance and healthcare costs in the US in general?
I think we all have work to do. And I think it's fair to say that the healthcare in this country, we need to improve access to it. I think we need to improve the quality of that healthcare that's delivered, as well as it needs to be far more affordable than it is now. And I think there's a number of factors for that. But I'd say we also have more than sort of enough solutions that are on the table that we are at Anthem are working on to address those very issues. So I, for one, am very optimistic about what we can do in the future, knowing all the lessons that we've learned from what has and hasn't worked in the past, and using all of that knowledge to kind of shape the future of healthcare.
So if we continue there, how do you think that healthcare could be intermediaries?
I think part of I think the issue is that consumers lack information and true insights about what healthcare costs, what's effective, what's not effective, what's working and what isn't. So one of our goals at Anthem is to simplify all of that and make healthcare much more transparent and open. What we want to really create is sort of this integrated, seamless end-to-end experience. Right now, if you go from a doctor to a hospital to another hospital, then in all of those kind of visits, the data kind of stays locally in one hospital system or a doctor's office. What we want to do is collect all of the information from all the visits to get insights with security and privacy, and with this notion that consumers own their own healthcare data. We really want to change the equation radically to where we want to connect all the dots in the ecosystem and integrate them into a common platform. And then with that common platform, we want to be able to deliver truly simple and exceptional experiences to our providers, to our consumers, and all the other stakeholders that are part of this healthcare puzzle in the US.
How do you think you can achieve that transparency? One of the big issues is, that sometimes even doctors won't know if the patient asks them how much a service is going to cost.
We certainly have that information. I think the question is, how do we make it more ubiquitously available? For example, on our mobile app that's called Sydney Health. Consumers can type in and look up, what a certain procedure is going to cost. What is it going to, cost to get an X-ray, and compare prices, and select the one that's most appropriate, based on quality reviews, outcomes that were achieved by others that have used that service, and then make informed choices, if you will.
I think this is all going to make a little bit more sense if we perhaps explain a little bit about the role that you have. So you're leading the transformation of Anthem to become a digital AI first enterprise. Let's stop there a bit. What does that actually mean? What's the grand vision and the roadmap? You've been developing this for a few years now.
Yeah, maybe I'll start with that last part of your question, Shasa, which is, what's the end game here? The end game is to make healthcare far more predictive, far more proactive, and personalized, so that the experience that our consumers have, that our providers have, and all of our stakeholders have, is seamless, simple, and delightful every time they use it. To do that, it means that we have to use data, use insights, use analytics, use predictive technologies, use exponential technologies to change every part of our business. Our core business processes, like the way in which we interact with our providers, our doctors, our stakeholders, need to change. Things like claims adjudication, claims processing, billing, enrollment, new product capability creation. All of those things have to be much more automated and efficient and simple. As we sort of implement and roll that out at scale, what it means for us is that with every interaction that we have with our stakeholders, we're able to collect more data and use that data to create more insights. And with those insights, then we can appropriately engage all the stakeholders using highly personalized solutions, and then learn from what's working and what isn't, and then continually get better.
Can you name a few examples of what's already been established?
So, for example, a few months ago, we rolled out a application called Sydney Care. Sydney Care uses Anthem's vast amounts of data and predictive capabilities. And what it does is it allows any consumer in the US, anyone can download and use it. If the user has some symptoms, they can triage symptoms using Sydney Care's AI triage capability. So if, let's say, I'm using it and I have a cough and a fever and some other symptoms like that, I can enter in those symptoms, and the AI capability will compare those symptoms to the millions of others that may have had similar symptoms, and then funnel you down to a hypothesis on what others like me have had similar symptoms. What did they end up doing? And at that point, it allows users to text with a doc and understand and get more information, or have a telemedicine video visit, or schedule an appointment and go see a doctor, and compare and shop for services like lab tests and other related sort of in-person services as needed. So it's sort of a comprehensive virtual care that's delivered via an app, and especially in times of crisis and during the pandemic. It was something that was very broadly used because people couldn't go in to see their doctors in a time of need.
Speaking of COVID, how did it impact you as an insurance company, the costs and everything related to patient care? Because we've seen some hospitals go bankrupt or their income significantly decreasing because procedures were not done due to the worries about or prevention from COVID.
Yeah, so for us, there was quite a bit of uncertainty, let's say variability in what we were dealing with. There was certainly a huge spike in our consumers, members that were using telehealth services. And rightfully, you point out, there was a huge drop-off in people that were, sort of getting care in hospitals for things like elective procedures. As we navigated that crisis, what we needed to do was focus on what care was needed by our consumers and members. We rapidly kind of configured our capabilities to deliver that care virtually. Like I mentioned before, we made the AI triage capability available rapidly so that consumers can use that where appropriate. And then we proactively reached out to consumers and members that needed to get in-person care. Like if there was a surgery that was needed and putting that off would jeopardize a person's health, we looked to figure out how we could get some of those services delivered at alternative locations. So in some ways, we reached out proactively, figured out where we could get care delivered, whether that was home or an alternative location other than a hospital, and we got that taken care of as well. So those were some ways in which as the crisis unfolded, we were able to kind of configure Anthem's response appropriately to make sure that consumers' needs and care got delivered regardless of what was happening around us.
Anthem provides one of the largest certified de-identified health data sets in the US, and you actually opened up that data set not so long ago. So in September, you launched a digital incubator where the value proposition is basically that developers can use that anonymized data to test their solutions. Can you tell me a bit more about the plans here? What's the big picture? What are you looking for in this collaboration? Is it an insight in what's happening on the market? Are you looking for very specific partners?
In Anthem, we developed something that we call the Anthem digital platform. So the digital platform for us means it's a way in which we could harness our data and secure it, anonymize it, and then create ways in which we can make it available to our internal community of developers, data scientists, as well as potentially partners that could, leverage selective insights and data from our data sources to create capabilities for us. We know that Anthem, we need to develop certain capabilities, and we are. But we also know that there's a wealth of information and innovation that happens in the ecosystem, both in the U.S. as well as globally. And we want to find a way in which we can harness all of that innovation into something that could be of benefit to Anthem's stakeholders and Anthem's consumers. So the incubator was launched with just that in mind, which is let's leverage the power of the global ecosystem and find a way where we can curate them and provide them with enough knowledge, both from a business as well as technology perspective, so that the solutions they develop ultimately will be much more on the money when it comes to delivering what our stakeholders need, and ultimately create an integrated experience. So there's no shortage of good solutions in the market today. The issue is that each solution sort of exists in a silo. So there might be a really good patient scheduling solution. There might be a really good diabetes, management solution, and there might be a really good cardiac care solution. The issue is that those three things don't talk to each other, and they're not really integrated. So with Anthem, what we're trying to do is find solutions that are really best in class and integrate them into the ecosystem, and deliver an experience that's integrated for our consumers, so that scheduling and chronic condition management and surgery management and whatever other capabilities are needed are all kind of tied together and seem like one cohesive thing to our end users. And that's really kind of what we're trying to do with a combination of our digital incubator and our digital platform.
How is that different to what Apple Health is trying to achieve?
I think Apple Health is, first of all, Apple's a great company. I think the fact that they have a consumer and a privacy, sort of lens through which they approach health is great. We sort of share the same sentiments in terms of protecting consumers' data and their privacy, and only using the appropriate data based on permissions that we receive from our consumers. So I think what Apple is trying to do really is to deliver health solutions to consumers. So if you use an iPhone or an iWatch or an iOS, sort of widget or a device, then there's a suite of solutions that are available to the end consumer. What Anthem is trying to do is really deliver solutions in the context of kind of the healthcare ecosystem, which means that we have to create solutions for our providers, right? i.e. our doctors and our hospital systems. We have to, of course, deliver solutions to our consumers. but we also have to account for what solutions are needed by the community and the caregivers, solutions that are needed by brokers and agents, solutions that are needed by for employers and our state sponsors, that account for programs like Medicaid. So if you put all that together, it's not just a consumer sort of lens that we need to solve for. We need to solve for the collective whole of all the stakeholders. So the incubator, in some ways, is going to partner with Anthem's core capabilities to develop solutions for that collective stakeholder group, which is, I'd say, broader and deeper than Apple's approach to health.
And you mentioned that in this quest, you're looking for solutions from across the globe or developers that can come from any country, basically. Can you tell me a little bit about the diversity that you saw in the applications or the structure of those that are currently in the incubator? How many companies, individuals, or teams are working at the moment?
So this is early stages. We've got about a dozen or so companies that are let's say part of the incubator at the moment. The solutions that are being curated range from improving personalization for our members, include solutions that essentially make it easier for providers to exchange information with each other. So if there's a primary care physician that needs to send certain medical information along with things like X-rays and MRIs to a specialist, then we want to be able to provide a mechanism and a utility for making that happen. So one of the companies we're looking at is doing just that. There's another one that's providing peer-to-peer support, for therapy, where I'm at home and I might be able to reach out to others that have similar sentiment and are facing a similar issue, and compare notes and create a support group around that. As they make it through the process, our goal is to integrate solutions like that into Anthem sort of digital ecosystem and make it available as a seamless end-to-end experience for our consumers.
Is this something that the companies that are taking part in the incubator going to be able to scale on a broader level? So what I mean is the problems that you describe, the lack of interoperability between the GP and other entities or the peer-to-peer support, those are quite general problems that apply to basically any healthcare consumer.
Yeah, you're a great question. This is the intent here is that these companies will have address a market level problem. They're not just specific to Anthem. So we want to make these solutions and companies, be viable businesses in the market. And so therefore they need to address issues just beyond, what's appropriate for Anthem.
Did the whole year and the fact that we are living in a pandemic which affected healthcare technology in a positive way and shifted the way we think about healthcare in practice, not just in theory and in conferences, did that have any effect on the way you're thinking today about, the whole AI transformation of healthcare and in the end, the incubator and how you're running that?
And the COVID, crisis, the pandemic and the crisis that ensued, I think have accelerated our efforts to sort of apply, digital technologies and, related capabilities in all parts of our business. As we, were reacting to the crisis initially, our first line of defense was to kind of configure our assets and deploy and help the right information and the right, insights be available to all of our stakeholders. So we did that through something that we developed that was called the C19 Explorer, which allowed us to model and understand the scenarios that were unfolding across the country, and and really sort of then do some modeling around how we should respond to it. But once we got past that, and that's still being used, we really stepped back and said, how should all that we've learned through this crisis be used on a go-forward basis to rethink and reimagine what needs to happen in the future. We know that providers are comfortable using virtual means of care to deliver care, and that care is of the same, if not higher quality than in-person care. We know that consumers could rapidly adopt digital and virtual capabilities to receive care. So knowing that, we now have an opportunity to reimagine the healthcare infrastructure in the country, where digital, virtual, and in-person care could be used seamlessly and interchangeably as appropriate. But in every interaction, in every way in which care is delivered, we want to be able to collect the data. We want to be able to create the insights from that data. We want to make sure that consumers are always aware of what data is being collected and that we're protecting the privacy and security of that information, but then amplify every interaction with that information and then make every subsequent interaction all the more personalized and all that much better.
So did this realization about the preparedness of providers to use technologies and telemedicine and the preparedness of consumers to gain positive impact of that kind of care, did that really come from COVID, where we were forced to do that? One of the reasons that telemedicine wasn't used more widely before COVID was the fact that the payment models weren't aligned to incentivize providers to give telemedical visits to their patients.
So telemedicine has been around for probably a good dozen years, so it's been slowly but surely getting more and more acceptance. What we saw during the pandemic was that this could be adapted and used at scale. Secondly, we also were looking at ways in which we could appropriately create the right incentives. But also the time that's spent, when a doctor is doing a telemedicine visit or is perhaps doing something that's asynchronous, like providing care via email or via text message, it's not the same. It's the quality is always paramount, but it's not the same. So I think in the future we will look at how those things ought to be reimbursed. But for the moment, our focus is on making sure that the care is available ubiquitously and it's seamless across all the different ways it could be delivered.
You mentioned that there were a lot of lessons learned as how all this could work. Can you mention any specific examples of maybe what surprised you this year in the journey of adapting to the new way of care?
Yeah, what's surprising is just I'd say the providers are already, I would say, adapted using technology and virtual, sort of capabilities to interact and connect with their patients. So some providers were using FaceTime, others were using any of the video conferencing capabilities that you might be familiar with. So there was just a broad range of video, virtual, digital capabilities that are already being used by providers. And it wasn't always, I think, obvious to the broader ecosystem how deep that use was. What we learned during this crisis was it's not just a matter of providing a telemedicine capability or a digital virtual capability, but how do we connect all these dots? Getting the provider's input, getting the members' input, the consumer's input, and then saying, well, how could we deliver not just a care that's delivered over a video service, but how do we actually amplify that, provide the data, provide the insights? That was the big lesson learned, which is we know it was theoretically possible and it was being done in pockets, but to be able to, coalesce all of that and deliver it at scale was perhaps one of the key lessons that we drew from this.
If I understand correctly, does this mean that you now have some additional data that's more easily gathered with the use of adapted telemedical approaches that are not Zoom or any other teleconferencing service?
Yeah, exactly. So if you were to use just a generic capability to deliver care via video service, it's not going to have all of the surrounding data leading up to that visit and after. Whereas with Anthem, what we're able to do is, let's say if someone wants to schedule a telemedicine visit, we're able to triage kind of the reason for that visit and get the information, also look at what information is already available on that particular member in our databases, and then summarize all of that for the doctor. So the doctors can then essentially be starting with a head start during that visit. And then once the visit is concluded, what we're able to do is create a summary of that visit, and then with the doctor's approval, upload that and update their electronic medical records. And using the same information, also generate the claim for Anthem. That could all be a seamless transaction, which at the end of the day helps the providers to be more productive, less paperwork for them, more time spent with patient. And then with each interaction, all the data leading up to that visit is made available to everyone that needs it. And following that, if prescriptions are needed, we can, ship that, make that happen in real time. We can then sort of track what happens after the visit, right? So that in the next telemedicine visit or a digital visit or an in-person visit, all of that information is also made available.
Which just got me thinking about the differences between those that have been insured with you for several years, for ages, and those that perhaps started getting in your insurance this year or maybe a year ago. One thing that's often discussed in healthcare IT is the lack of interoperability, and there we always talk about the lack of interoperability among healthcare providers. So you just got me thinking about what about the interoperability and the exchange of data among health insurance companies? Do you get the medical history of a new individual so you could create that summary and present it to the doctor that's doing a telemedical visit with your customer?
Yeah, so we, Anthem, makes our information available to the consumer so that they can use it and make that information available to their doctors. And of course, we can do it on their behalf. So if, for example, if they leave Anthem and join, someone else, that information goes with them and they still have access to it. Let's say a member is new to Anthem and, previously they had, some other insurance carrier. If that insurance carrier makes their data available, we certainly have the ability to ingest that and, harmonize it so that we can make the combined history available to the doctors when needed. But that's in some cases up to the other insurance companies to participate in that or not. But the good news is that there's upcoming regulations that are going to make it so that insurance companies have to make their claims information available to consumers. And it'll be up to consumers to decide, whom to share it with and, how to use that data.
Okay, something for the consumers to look forward to. Harvard Business Review recently posted a survey where 40% of executives said that the obstacle to AI initiatives is that technologies and expertise are too expensive. AI has a lot of potential. So to which extent can its use curb healthcare costs? Precision and personalized therapies can be highly effective, but carry sometimes insane price tags.
Yeah, I think the big potential for AI is in that, we can predict something about a person's future health journey and take proactive, preemptive steps to keep a person healthy. But the fundamental promise of AI is that it could be much more proactive, personalized, and preemptive. That being the case, well, how do you make the transition from what is healthcare today, which is largely reactive, retrospective, and expensive, to a future where it's proactive, preemptive, and predictive? So that cost of going from the current to the future, I think perhaps is the crux of that survey there. And I think there are ways to be, sort of get there more cost effectively, which is the technology itself, I think, is getting cheaper and cheaper by the day. So if technology compared to 10 years ago versus technology compared to today, a lot of AI is open source. Compute capacity, has grown exponentially. The cost performance is continued to, the price performance has continued to double every 18 months or so, very consistent with Moore's law, from the 70s. So what that means is we've got more data. The data could be stored, far more cheaply than it ever was before. We have more and more sophisticated AI algorithms. Many of those AI capability is open source. So the notion that technology itself is expensive or a barrier is probably not entirely accurate. I think the big question is how can all that technology be harnessed and applied in a business context so that we can systematically and methodically move businesses to adapt those things and really achieve their objectives of making healthcare much more proactive and predictive. And I think there's ways to do that that are effective, which is rather than boiling the ocean, set ambitious but pragmatic goals, and then start small, leverage open source, leverage ecosystems, leverage the global innovation that's happening, and harness all of that to effect for any one company. And then as we are learning from each sort of pilot and experiment, you can kind of systematically plot a course for scaling that. And then, talent, I think, is absolutely spot on. AI talent is expensive and hard to find. But I think one of the misnomers is that, an AI project needs only, AI and data scientists type of resources. What we find that on an average team that is responsible for creating an AI capability, 80% of the work has to do with things beyond AI, which has to do with data quality, data integration, sort of creating the other engineering that's required to create a solution, and then creating sort of solutions with a human-centered design perspective in mind that ultimately aims to simplify the experience for the consumers. AI is probably 10, 15, 20% of any one given initiative. So I think, yes, it's an expensive resource, but also it's not like you need thousands of engineers that have AI expertise. You need some percentage of that skill set to be mixed in with existing talent and resources. And I think the existing talent and resources could also be retrained to learn AI so that it's not as expensive to adapt and deploy these solutions.
As you said, AI has a lot of potential to bring more proactivity and prevention to healthcare. However, the precision and personalized therapies are increasingly developed when the disease already occurs. So we see a lot of progress in oncology, in cancer treatments, and unfortunately, those treatments can be effective, but they are extremely expensive, especially if you have a free market where the drug makers are the decision makers regarding the price. So I wonder, do you have any power whatsoever when it comes to drug prices and, making therapies available? Here in Europe, where I'm from, the regulation is quite different, so insurance companies do negotiate a lot. But it's a different market, of course. I'm not saying that that should not be taken into account.
I think I like the way you framed it, which is that AI has a huge potential to create sort of precision therapeutics and personalize the therapy for everyone as an N of one. So I think while that's the end state, there's still a long ways to go to get there. For example, one of the things we're doing is we've got a pilot program where our members can sign up for virtual, clinical data trials, where using the data that's available on my phone, genomic data and other omic data were available, combined with clinical claims and lab and other types of data, I now have sort of a unique profile of one, right? That kind of is my fingerprint and my own sort of unique set of characteristics of what defines my health. So based on that, we have algorithms that run on the devices, on the phones and whatever other devices that are used to as a primary sort of productivity device. Using that profile, we can then match you up to, clinical trials where we track how you might respond to a particular therapy. And based on that, we're able to then customize the therapy to the person's individual data. So that those types of advances are already happening. Once we're comfortable that the pilots are showing positive results and we're able to learn from what's not working and adapt this, you can picture in scaling this, I can't predict exactly how long this will take, but, some point in the future, we'll be able to scale technologies like these where the personalized clinical trials identify the therapies, but also the clinical trial process itself could be based on synthetic data, where we can essentially take a drug protocol or a therapeutic protocol and then simulate how it might, affect any one person or an entire population. And based on that, adjust the therapy protocol so that it could be personalized to any one person, and it would be far more effective. So that, I think, is more a question of timing and enough experiments and enough trials to get us the evidence to support that. But once that's there, I think the change that needs to happen on the manufacturing side will be relatively fast.
Since you mentioned clinical trials, to which extent are your processes and what you offer to customers automated? So, for example, if you have a patient and obviously his medical data, and suddenly that patient has a new diagnosis, do you automatically send them the information that a specific clinical trial could be appropriate for them? Because one of the big issues that patients still face is access to clinical trials.
So in this particular case, this is through one of Anthem's partner ecosystem companies called Doc AI. Anyone that uses Doc AI and signs up for that service, we're basically continuously curating all the available clinical trials and making them available to the users of that particular application. So yeah, it happens in real time. Now, it doesn't cover every single condition and diagnosis, but for many conditions, we already have the service that's available.
What's your idea of healthcare, or how your services are going to look like in a few years? We mentioned that you're leading this AI transformation. I'm sure you have a roadmap, a timeline. Can you share any of the goals of what you expect to have implemented, ready to go in 3 or 5 years?
Many of the things that I mentioned are already available today. And so I think the future is going to be more about ubiquitousness and scale. So scaling and broad access is one key factor that we're always measuring. At the same time, there's new capabilities that we're continuously looking to develop and integrate. And so it's almost like waves, right? So it's one wave sort of finishes and another one sort of follows, and you're going up the curve of, does it work? Is it scalable? Is it feasible? Is it viable? And then once all those questions are answered, we quickly scale it, and it's on to the next wave and on to the next wave. So I don't know that there's one point in time where I can say all this is going to be done. But if we were having this conversation 3 to 5 years from now, I'd say that all of Anthem's members would have a personalized prediction of their future, healthcare journey. They'll have continuous, engagement where they can learn about what they can do to stay healthy. We'll have tailored insights that are delivered in a highly personalized and simplified manner, whether that's through an app or a voice assistant or any other device. It all will be, seamlessly integrated to where family members can work with each other on common goals of staying healthy. The broader caregivers that are surrounding a family and a community all have access to the appropriate, health tools and capabilities so that they can, work with each other to improve, lives and health of community. And then the broader system of health in the U.S. between providers, drug manufacturers, life sciences companies, alternative care delivery sites like clinics and retail, all will be connected into one digitally integrated network, if you will, that is always active and always has access to real-time information and insights. To where as a individual's trajectory is showing a trend towards something that's unhealthy or chronic or acute, that there's a proactive intervention that's activated through this digitally connected network, that changes the trajectory of health and hopefully keeps everyone healthy.
Which of the technologies are you most excited about that are going to be very useful for what you're doing and for healthcare and your consumers? So, for example, you mentioned voice assistants, and voice technology has been quite proliferating in the last few years in terms of getting patients information, helping them find information, helping them remind for things. We are slowly seeing that VR is entering the space. So, for the specifics of what you're doing, trying to bring the patient a whole patient journey, a few predictions, very nice insight into their health and their health record. Which of the technologies do you perhaps are not used so much, but you're kind of curious where they're gonna go?
Yeah, so I think most exciting, I think, from maybe if I could categorize it in sort of two broad areas. One are like foundational technologies that enable us to deliver better experiences. So on the foundational side, I'd say artificial intelligence, machine learning, and blockchain are the ones that continue to have great promise, already showing lots of good results, and really excited to see what that evolution is going to be in the next 5 years, as next 3 to 5 years, as those things sort of tend to become more and more sophisticated on an exponential sort of curve, if you will. On the more interesting consumer engagement side, or the stakeholder engagement side, I think virtual reality will have a big role. I think augmented reality, where the data and the insights could be overlaid on an augmented reality experience and delivered through whatever is the appropriate channel. The channels could be voice, could be television, could be your phone, could be your watch, could be your glasses. I think the possibilities would be endless. The visualization of the engagement, where augmented reality becomes kind of a seamless and ubiquitous part of that experience, I think in 3 to 5 years is absolutely on the cards there.
You've been listening to Faces of Digital Health. If you enjoyed the show, leave a rating or a review by going to www.lovethepodcast.com/Faces of Digital Health, and you will be redirected to the platform appropriate for your device. Stay tuned.